So good morning, Howard and Stephanie. I haven't, as I stated earlier, I haven't had the pleasure of meeting either of you in person yet. I think both of you work out of our Hartford office. I'm down in our New Haven office. But just to get a sense of a little bit of background, how long have you two been working together?
Well, Howard and I first met in the mid-90s. We worked together at another law firm for many years, and then I took some time off, and when I was ready to come back, I found Howard and joined up with him. So it's been over a decade since we reconnected in this practice group together.
And how long have you both been with Halloran?
Months.
Months.
I think April 1st was our start date.
Excellent. How would each of you describe your approach to your legal practice? Is there one defining philosophy you have behind the work you do?
Well, I mean, I think like in all practices, the client is front and center. And we try to fulfill a need that we think is a unique need that we can only fulfill to the clients.
Anything in particular for you, Stephanie?
Well, I agree with Howard. It starts with the client, and our approach is really to give the client the best resolution for their business practice. So, because most of the cases that we have are against one of their business partners, someone that they're a provider that they're providing insurance to. So in the end, it's hopeful not to destroy that relationship, but to be able to resolve something in a business to business way so that the relationship can continue.
Sure. And, more specifically about, the types of cases you guys handle or the general practice area, either of you or both of you could touch on that briefly.
Sure. So really it's healthcare cost containment, representing payers against providers. So, and what Stephanie talked about is that our business model is very different than a traditional litigation business model. What we try to do is to resolve the cases in pre-litigation in a business-to-business way. We develop the case without the benefits of any discovery, but doing informal interviews and documents and data review, and then try to work out a resolution that does three things. One is that it makes our clients whole looking back. Two is that it creates an environment that's healthier for both sides. And three is that we try to put in place some sort of mechanism that will protect our client from similar behavior going forward for that particular provider, so that 3 or 4 years from now, although it would be good for business, it's not good for our client, that we wouldn't be sitting across the table from the same provider having the same conversation.
Mm-hmm.